Gentlemen, you are both drunk on cosmic wine.
Welcome to the show. I'm Dr. Mark Sylvester.
And I'm Dr. Richard Schulman. This is Alt Psych.
And we are live in 3, 2, 1. Actually, it was already like 5 seconds ago we were live.
I was live the whole time.
I just became alive. Because
Okay,
I've been trapped in this computer.
You sure we're not trapped in a computer simulation?
I don't know, that's gaining a lot of...
Would that be a hallucination or a delusion?
I think it could be a ego dystonic, possibly non-bizarre.
Okay, well, in fact, since we're going to be talking about hallucination and delusions today, I want to start with our mental wealth tip.
Drum roll.
But yes, give me drum roll. So I'm gonna give you okay, I'm gonna paint you a picture.
Oh, I love pictures.
Well, I'm not
Alex Gray.
Yeah, but I like that one. I like the one behind me that better actually, but it's not as clean as yours. Anyhow, paint you a picture. The Sweet 16 in the NCAA basketball tournament. Now, basketball is unique because the free throw line is the same everywhere in the world. 15 feet to the basket is 10 foot high. Nobody's guarding the person who's shooting the free throw.
The ball's round, correct?
The ball is round and the hoop is round too. Okay. So in the last 2 minutes of the game, you got a 19-year-old kid on the line, 20,000 lunatics in the stands. Well, this is, when there were lunatics in the stands, screaming.
Cardboard lunatics.
There's nobody in the stands today, but there were for this study. And 20 million watching on TV. Does free throw shooting with nobody guarding the guy get better, worse, or stay the same in the last 2 minutes of the ball game?
I'm going to go with it gets worse. They're tired, and most people would guess that.
You would think, but it actually gets 12% better, and there's an explanation, and the explanation is our mental wealth tip of the day.
That they're delusion. Oh, yeah, okay.
No, it's the tip for everyone out there who's not delusional at the moment. Under stress, you do what you've overlearned. So when with the high stress, those kids are there. If you look at the close-ups from the TV cameras, they're not even there. They're back in the gym shooting their 10,000 practice shots. This becomes important, like for police officers, let's say, who have to deal with very stressful situations, and the use of stress inoculation. They do it with, like, the astronauts are in training, are faced with every possible malfunction that could happen in a spacecraft. So it becomes a real important thing. So remember, if you're under stress, what you've overlearned is what you're going to do. And if you've overlearned hallucinations and delusions, we can go right to our topic of the day.
I thought we've taught people that when we stress, we regress. So if you're all stressed, you're just going to regress to like a 3-year-old trying to throw the basketball.
Well, because you haven't learned how to deal with this particular situation, that you kind of regress to a place where you've been dealing with it. Actually, for some people, and in my experience, they regress to wherever
to like the Lakers
reminds them of a certain situation in life. So.
Look, I feel a little guilty about something.
Really? Wait, where's my yellow? Okay, wait a minute. Okay, we can begin.
Mark, this topic, hallucinations and delusions, was partly done as like an educational piece, because most of our topics really go down the rabbit hole, and I think this one could. It would get a little bit more complex. We struggled with this a little bit, putting the show together into how to not make it overly complex. But I think there's so much misunderstanding about hallucinations and delusions, what they are, what they aren't, what's the difference, what's the similarities, that, it's just more kind of this one's more of a review, I guess, because it's very interesting, the misinterpretations, misunderstandings. A lot of the words that people say have become kind of almost cliches, or like, oh, he's delusional, or oh, they're I'm schizophrenic, bipolar. We plug these words together, and they mean something very, very distinct and important by themselves. But if you don't know the meaning, then you just cram a bunch of them together, and it sounds like you're extra smart when you're really extra dumb. So we want to make people extra clear so they can come across as extra smart when they point out someone who's extra misinformed.
Well, I
It,
mean, it's just it's non-ordinary mind.
it is still fitting the non-ordinary mind. That's why it's here. But
Yeah. And
you'll
and people will have all right, there's one of my sort of stories that I tell people about spiritual events is the devotee goes to the guru. He says, I want to learn enlightenment. So the guru says, well, inhale and exhale and practice it for a while, and then we'll talk later. So the devotee is inhaling, exhaling for hours. And of course, he keeps going because he's very eager. And in his little hut, a lightning bolt comes in and he sees the Buddha, jewel encrusted with flames all around it floating before him. He runs back to the guru. He says, Guru, I've had the most marvelous hallucination. No, the marvelous vision. It doesn't say hallucination, vision of the Buddha. And the guru says, inhale, exhale, I'm sure it'll go away. So at a certain point, is are these experiences, we could say, did they happen? Did they not happen? Did people make them up? As we were thinking about this, I remembered a story about an old patient of mine who called me up one day. This is before, actually, she paged me. That's how long ago it was. And when I called her up, I said, what's the matter? She said, put me in the hospital. I said, why would I want to do that? She said, well, I'm hearing voices. I said, what are the voices telling you? Well, to love everyone and to be kind to children and animals. And you're not going to like kill yourself or hurt anybody. No, why would I want to put you in the hospital for that? And we had a long talk. She was having a really spiritual experience. Was it a hallucination? Was it a delusion? I don't know. Seemed pretty nice to me. She was a very nice person.
some of
And
them certainly are.
and it wasn't like a delusion of grandeur or unlimited love. It was a sense that that higher intelligence was talking to her and telling her all these beautiful things. If that's a delusion, I'll sign up.
Yeah, we could sell that as a pill or something.
I think we have actually. It's called MDMA.
You get to do the mental wealth tip of the day.
Okay.
I get to do the token dead white guy of the day,
Okay.
who is Sir Thomas Brown.
Okay.
And this cat, he was a 17th century physician, and
Okay.
he coined a word called hallucination. Which, fun fact, it derives from a Latin word, which I think pronounced hallucinari, with an Italian accent. I don't know.
Did they speak with an Italian accent in
No,
ancient
they
Europe?
didn't. I just threw that in there for fun. But what's really fun is what hallucinari means is to wander in the mind.
Ooh, I like that.
That's a fun one.
I like it a lot.
Modern day, we define a hallucination as a perception in the absence of an external stimuli, but it has qualities of real perceptions. So that's like the short version.
we,
Um,
we happen to think that these things are illnesses or illusions, and who knows? Maybe this woman was talking to higher intelligence.
well, illusions are slightly different. So we'll sort that out. We'll sort that
Okay.
out because, I mean, I think people hear hallucinations, or and they can think of hallucinogens, um, because they can be associated with drug use. Hallucinogens used to be called deliriants prior to that. It's a fun word I like. I'm going to bring it back.
It's
Sleep
like fun
deprivation.
words too. It could be a third category of stuff.
We were talking about sensory deprivation can invoke hallucinations.
Yes.
Sleep deprivation, I just said. Of course, psychotic illnesses, what we deal a lot with. Neurologic disorders, Parkinson's, some other frontotemporal dementias. One of the most classic, of course, is alcohol withdrawal can cause something called DTs or delirium tremens. So, what's interesting is they're distinguishable. And actually, you and I were talking about this before before the show, from like dreaming, right? How is it different from a dream? One, you're asleep when you're doing the dream, um, and two, sometimes you can recognize that as unusual. Like a pseudo hallucination is still kind of a hallucination that you know is not real. So that implies the hallucination itself, you aren't sure or you're convinced it is real. And we've seen these cases where someone gets the hallucination of the voices telling them, we'll just say, your soul's gonna spend eternity in hell if you don't walk up to that gas pump and self-immolate. um, put your credit card in first. But those are powerful things. People will carry that out because they believe 100%, maybe 1,000%, if you're going to go out in such a horrific way, that you're saving your soul.
I
So it
remember
has it has a certain tenacity to it.
post my niece, after I had my knee surgery, I had a bad reaction to the pain pills. And I remember my ex coming in and going, "Who are you talking to?" And I remember
Yeah.
going, "I don't know. They were just here." I had no memory of talking to anybody. Interestingly enough, when my dad was in a terrible accident, they gave him pain pills. He had the same reaction. He was hallucinating all kinds of things. In fact, he told me that he hallucinated the Beatles and that I was in them, which of course, was probably would have been true.
Yeah.
Could have been. And then he says, "I see Marilyn Monroe," and my mother goes, "Get Marilyn Monroe out of your hallucination."
But the tenacity of it, it makes it different from a dream. It makes it different from a pseudo hallucination, and it makes it similar to a delusion, which is coming up next. But let's see, it does not mimic real perception. An illusion you were just mentioning. So an illusion involves a distorted or misinterpretation of a real perception. We talked about this before on the show. Matter of fact, we talked about it last show, and you were saying, "Hey, you see that hose, and you think it's a snake, but it was always a hose or a rope." I think you said.
It did, yeah. But
Um,
hose brings up other kinds of
all right,
things
Mr.
that
Freud.
are fun.
I mean, doctor. But that's an illusion. So but it's a real stimulus. It's a real stimuli.
I have Mr. Freud right here.
I've got one too, but I kind
You'd
of wish
like
I
to
had
talk to
I
him?
wish I had a Captain Picard, like, and they could just
I,
like battle it
I
out.
can I can arrange for that.
That would be cool.
Yeah, I'll put it
Um,
on my list of for your birthday.
of course, imagery, with like imagination, creativity, that's not a hallucination because it's thought that the thought generated it.
Right.
Um, so it doesn't mimic real perception, but it has a voluntary control to it. That's a hallucination does not. And then they also differ from delusional perceptions, which again I was saying we were going to separate words. I don't usually use words like delusion, delusional perceptions, but that's when a correctly sensed or interpreted stimulus, like a real perception coming from outside the skull,
Hmm.
is given some additional and typically bizarre or absurd significance. So that kind of might be like an idea of reference, or that things are connected to you. Maybe the TV's talking to you, or the weather's connected to your thoughts. But the cool thing about hallucinations, because they require input, you can hallucinate in all of your senses.
Oh, no.
So most people incorrectly think Well, that means that you can only have 5 categories of hallucinations because we only have 5 senses. And turns out that's not true. I know. They'll just blow your skull. We
Well,
got the
not from the
5.
side like a dog, you know. Please tell me more.
Can I have a sausage, please? So you can have the visual, auditory, olfactory, gustatory, and tactile hallucinations. And these are more uncommon, but I've certainly seen variants of this. You can also have proprioceptive hallucinations. Um, Alice in the Wonderland being 10 feet tall might be a good example of that.
Wow.
Um, equilibrioceptive. So that might be that sense of falling when we talked about hypnagogy and hypnopompy, which are considered normal hallucinations, by the way. We'll come back to that. Nociceptive. So nociceptive receptors are the receptors in your skin that feel pain. So it's below the tactile. So tactile might be what they call formication, one of my favorite words.
Would you include phantom limb pain there?
Yes. I think that's a fun one.
That's a
Uh,
real thing. I
oh
work
yeah.
from a physical medicine
Well,
rehab.
yeah, I'd include the thermoceptive hallucination there too. So some people feel burning as if their whole body's burning in fire, and their body reacts as if it's burning in fire, even though there's not tissue damage, which is really interesting. And then chronoceptive hallucinations, hallucinations with respect to time and the perceptions of time. I described one on this show. We'll let the readers figure out what it was, because then
Didn't
I you got
Einstein say talk about that? Just like if you're when he was talking about relativity, that if you're hanging out with a pretty girl, 3 hours seem like 5 minutes, and when you're with an insurance salesman, no offense to insurance salesmen out there, but that
dentist office.
20 minutes felt like 3 days.
Yeah, or okay, the better one, which I said on the show before, was when I woke up and I felt as if I was an 80-year-old looking back 50 years in my memory, or 60 years. I don't remember how old I was when this happened. And the we talked about ego dissolution, where you forget whether you're male, female, young, old, tall, short, job, whatever. But this was sort of a twist on that, and that I had a presence of mind and awareness, just like the viewers saying, "Well, I'm this old, or I'm a mother, or daughter, or father, son." Was an old man, retired, looking back on a memory long ago. That was a very discombobulating type of
Did
hallucination.
you, did you have a little flute like in the like Picard in the Star
I know
Trek?
what you're talking about. I
So,
was going to
yeah,
sing the tune, but that might
that
be
great Star Trek where
that
he,
is a good
you know,
episode. No, I didn't. But I didn't commit myself because that was a hypnopompic hallucination. It
okay.
was an unusual, it was a chronoceptive hypnopompic hallucination. But it's a fun one, it's a rare one, and it's the kind of thing I think people experience, and then they're like, I don't know, man, brain broke, and they just ignore it and move on. But understanding why the brain does this, what it means, what it doesn't mean, and paying attention to it is what we're all about here. And here's a fun fact. I want to see if you knew this. I purposely didn't tell you about this because I wanted to see if you could guess this.
Ruh-roh.
Did you know a mild form of hallucination is known as a disturbance?
No, I did not.
I did not know this either, but I like fact checked that. I confirmed it
It's
with
like
the
a
10-year
like a
old Pakistani boy in a chat room. It's legit.
really.
Yeah, and it can also occur in the senses that I just mentioned.
Okay.
Um, I brought it in because it's something we commonly see in severe depression. A lot of people will see shadows out of the corner of their eyes and their peripheral vision. A lot of times, movement. Usually, it's a dark figure. Sometimes they'll hear faint noises or voices, but typically the hallucinations that come up in a severe depression that are these disturbances of the peripheral visions. Now they can be upsetting because some people think it's a black figure might be this ghost out to get me. but it's very quickly corrected when the depression's corrected. So it's not something to be terribly concerned about, but it's alarming if you don't educate the patients or screen for it, ask for it, which I always do. And certain states trigger certain hallucinations, like classic schizophrenia. People have heard of schizophrenia, and they like the joke, "I have schizophrenia, and so do I," and that annoys me because that's something else.
Right. Me too. I always,
Dissociative identity, which we've talked about, formerly known as multiple personality. But schizophrenics classically hear voices, auditory hallucinations. Whereas visual hallucinations, yeah, they're more common in delirium, medical delirium, DTs. Um, Visual hallucinations, your brain's worse off. It's usually malfunctioning more if you're having visual hallucination.
the thing that
Unless,
I found fascinating working inpatient for several years. And by the way, I like schizophrenics a lot, and I speak schizophrenies actually. I was very good at communicating them, which might be diagnostic of
is
something
that
else.
like Cantonese, schizophrenies?
Yeah, well, it kind of is. The thing that was really interesting, and this could get into a whole other part of the discussion, was that the if you give them phenothiazines or other kind of antipsychotics, they you can control those hallucinations, delusions, but the odd interpersonal behavior persists. That I had a teacher tell me, well, you know, you're talking to a schizophrenic when the hair on the back of your neck stands up when you meet them, and it was uncannily true. Um, and you know, so I know you don't want to get into a big discussion about why these delusions and hallucinations happen in the brain, but there is a brain piece of this, you know, and people need to be mindful. If, you know, if they are having these things, it doesn't necessarily mean they're crazy. It could mean a whole bunch of things about what's going on in their physiology and their stress levels.
Yeah, and even terminal delirium, that has a certain uh, uh, flavor that doesn't fit this, because if so and so is going to be visited on Saturday by a departed loved one, and worse off, if another person, like a folie à deux, a hallucination shared by two people, seems to occur, that's a little more hard to explain when they die on Saturday, and or the nurse tending to them also sees what they see. That's a little bit different than a internally generated hallucination, we'll just say. But then you break down auditory hallucinations. About 55% of auditory hallucinations have a negative context. They're malicious in content. They're denigrating, they're condescending, they're commanding. They're not really friendly.
Right.
The scientific term for that, of course, is the ego syntonic versus dystonic. And your patient who wanted you to commit her had some ego syntonic hallucinations, and we have a much lower threshold for imposing treatments, whether that's powerful antipsychotics or ECT, electroconvulsive therapy, because it's not distressing to the patient. Whereas somebody that have mild but severely distressing, we might be more aggressive to try to get rid of those, like the person rolling up to the gas pump kind of things. And I
Well,
did.
with my patient, she wound up writing a book about this. She felt in the end it was a spiritual experience and wrote a beautiful book about it. So, I mean, who am I to argue?
Is it available on Amazon for our viewers?
It was a while ago, but you know, they may have run out. But
So, briefly, I would love to give the exact mechanism of what biologic hallucination or internally stimulated hallucination is, but we could not boil that down to a simpler explanation in the time period that we wanted. So, if you leave in the comments how badly you want to see that, we can do a whole show on that, because I think it's important. Or you can research that on your own, because this is
well,
something that's pretty well
it's
known.
important because um, it's not important unless it happens to you or somebody you love, because you know you want to know what to do with it.
Yeah.
So yeah, write a comment if you want it. We'll tell you, or Mark will, because he's smarter than I am about these things.
Yeah, I had it all written down, but we're skipping over that because
Okay,
I want to get to the delusions
let's get to the delusions.
because it's important to know the compare contrast between the two.
Okie dokie.
And people kind of get what a delusion is. But my favorite definition of a delusion is three words: a fixed false belief. Those are three really powerful words, and you need to really think about them. It's fixed, meaning it is not amenable to change in the light of conflicting evidence to the contrary. It's fixed, it's immutable. It's very, 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 very hard to change people's minds on that, but it's incorrect, objectively incorrect. And it is a belief that you cannot shake. It's something internally that they have volitional control, and that's the belief in it, really. So fixed false belief is a good way to remember a delusion. And they usually organize them into what we call bizarre and non-bizarre. A bizarre would be what most people would generally say is impossible, like, oh, I have an alien implant. Most people would say there's no such thing as aliens. um, that's bizarre. Whereas maybe, I believe my wife is cheating on me. Well, that's a non-bizarre delusion, because although it's not true, it's certainly capable of being true. Infidelity is not on the same par as aliens. So that comes from older interpretation. I don't think it's not as important of a distinction. I think it's more of a descriptor than, say, the egosyntonic versus dystonic hallucinations. But it's a good way to a further descriptor of a delusion. Some people will also say mood neutral or mood congruent. Um, and there's a lot of different kinds of delusions in the way that we organize them and classify them. And they do end up, because we're all human beings. We kind of all, experience similar emotions, phenomenons, and occurrences, and happenstances, and events in our life. And so you can organize delusions in a very neat way. Like, were you talking about one before?
Probably. Which one? Are you talking about the woman who heard the voices? Which one are you talking? What are we talking?
Towards the beginning, you were talking about I think you were talking about a grandiose delusion. Didn't you mention that?
If I did, I was grandiose about it. I can't remember.
That's probably what it was. But
Well,
I think people have heard of probably grandiose delusions. I think people have heard of.
I've actually. I mean, I don't remember saying it earlier in our broadcast today, but I have had people who said, well, God has given me the power to heal, or given me the power to read minds, or
The religious delusion would be God's given me the power to
that
heal.
would be like kind of the grandiose kind of, you know, um,
Well, the
we
grandiosity tends to occur in the setting of mania. So either in schizoaffective or bipolar disorder. Usually, a common matter of fact, it's one of the diagnostic criterion of bipolar is grandiosity,
right.
or omnipotence. Sometimes they can be more fantastic, such as supernatural. I have telekinesis. Um,
Well,
Now, if they believe
if
this,
you have telekinesis, raise my hand.
but
Well,
whereas they normally wouldn't believe that.
well, then you got the kind of like people who think someone is in love with them. Uh,
Erotomania, it's
yeah,
called. Yeah.
yeah. Um,
Or delusions of reference. What we're talking about, ideas of reference that can sometimes be a hallucination or delusion, depending on the sticky situation. Um,
or the common one, someone's out to get. I've had patients say someone's out to get them. In fact, one of my teachers told me a great story. He had a patient who claimed the FBI and CIA were out to get him, and he was working with this guy about this delusion that he had, and the patient disappeared, and About 6 months later, he said, I was contacted by the FBI to see if I had known where this guy was, you know. It's
That's a
not always a
persecutory.
delusion, I guess.
That's a persecutory delusion. A lot of
Right.
people like to say paranoid delusion. Those words don't go together. Paranoia is a psychotic symptom. Um, it could actually be considered a type of a hallucination based on how paranoia presents. And then a delusion is a fixed false belief. So paranoia isn't always all that fixed,
That-
and it's not got the belief. So it's kind of an oxymoron, like jumbo
Okay.
shrimp.
Okay.
Paranoid delusion. No, I don't like that one.
Okay.
Um, the delusion of persecutory delusions, or delusions of persecution, are what it's correctly called. But I hate to be, picking fly shit out of peppers, my grandma used to say.
You're, well, you're just trying to be precise.
Here's a fun one: katard. You know what that is? Most people don't, though.
Captain Katard?
Katard delusion, the false belief that one does not exist, or that they have died, or if I'm not correct, that they may be a zombie. That might have a
It
different
was
name.
actually a Beatles song from an LSD trip that John Lennon took. It was she said, I know what it's like to be dead, you know, and it's making me feel like I've never been born. Like, I guess the Beatles knew that stuff too, you
Wow,
know.
what a katard.
That's a
Delusional
good one.
jealousy, we already mentioned, right? Like
Yes,
the non-bizarre delusion of infidelity.
right.
We were just talking about a patient before the show whose prominent feature of their particular illness is a delusion of guilt or sin. And this one is ungrounded feelings of remorse or guilt that meet a delusional intensity, no matter what. This patient really, really struggles that they've done something wrong in the eyes of God, that they made some bad choices, and they're going to go to hell because of it, or God has given up on them. And despite all attempts to get the highest qualified people, I think the Pope himself could come in and sit this young man down and not shake that. That is a sign of a malfunction in certain parts of the brain that's getting somebody kind of caught in a loop that's difficult to get out of. And delusions respond much less than hallucinations with classic medications like antipsychotics, which is not usually known, but it's actually kind of frustrating because delusions that are more dystonic or even dangerous, we're going to go after more aggressively, which means we usually have to use more and more medicines, which don't respond as well. The delusions don't respond as well to that, um, or other tools. Some people have a delusion of thought insertion, or their mind being read, other people putting thoughts in or being able to read their thoughts. We talked about the TV talking to you. That would be a delusion of reference. Here's a fun one: delusion of poverty. It ain't a delusion if you're broke.
That's true. I remember when I worked inpatient, there was a schizophrenic patient who had taken the TV apart in the day room. I don't know how we missed seeing him. And I said, what are you doing? He goes, I'm looking for the transmitter. I said, it's a receiver, not a transmitter. He goes, no, 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 this one has a transmitter. Okay.
That would definitely, and I'm guessing you never got through to get him to understand or believe you.
I had an equally hard time getting his doctor to understand and believe me of how crazy this guy was, but that's a whole other story.
Well,
On
this
that
is,
happy note,
yeah, I'm trying to think. We haven't uh, touched on one other thing. Some people have dragged gaslighting into the delusional realm,
ooh,
and it's an interesting argument. I struggle with it. I wasn't even going to bring it up, but gaslighting seems to be more of like a sexy term these days. More and more people have heard of it, or they even understand what it is. And it does have some delusional features. I tend to think it's more psychologically based, so I struggle with that. But I also struggle more explaining delusions because, unlike some of the classic neurophysiology or dysfunction of that neurophysiology, which explains hallucinations and pretty well, it's harder to explain delusions in that kind of reductionistic, because I think there's a lot more of psychological and the belief that goes into it, the volitional component of it, whereas the hallucinations, there's not that volitional, or else it'd be called a pseudo hallucination or false hallucination. So, I mean, on that note, I'd put that in your pipe and smoke it.
But I
Um,
might get a hallucination if I did.
yeah.
Actually, that's that's why I don't use drugs.
Well, just close your eyes and starve yourself in the dark room long enough, and
I tried that too. It works.
the hallucinations will start. At
Yeah.
least.
Well, okay. So we're reached the end of our hallucinatory delusional experience here today.
Indeed, indeed, we have.
So
Do we have any hope of ever getting wrapped up? Right?
today, yeah, well, we have to do our sign off, which would be 1, 2,
How
3.
about until next time? Until next time.
Next time,
Be
be
well.
well. We got it right.
Mark the date.